Today we're going to be doing an examination of the nose, the mouth, and the oropharynx. So we're going to start out by just looking at the external nose, but I will have to look inside your nose later, and I just want to check for any polyps, and I just want to see what the color's going to be like in there, okay? Alright, so starting out, looking at the external nose, everything's looking good. It's nice and symmetric. I don't notice any redness or pinkness. There's nothing running out of the nose, so everything looks clear. So I'm going to next have the patient tip up your head, and I'm going to use one of my hands, and I'm just going to lift up your nose and put the tip of this inside and take a look, okay? Alright, I'm looking at the coloration and for any abnormal polyps or anything, and I don't see any polyps, and the coloration looks good. If the coloration was a really dark, fiery red, that would be indication of some sort of infection, and any paleness would indicate like an allergic reaction. But everything looks nice and pink. I'm just going to take a look at the other side, and that's nice and good as well. Alright, so the next thing that we're going to be doing is taking a look at the internal mouth. So I'm going to have you open your mouth for me. Alright, and I'm going to be using a tongue depressor just so I can help move your lips around and stuff a little bit. Okay, so have you open your mouth for me. Good. Look at the top here. Sides. Alright, I'm looking at the gums. I'm looking for any bony outgrowths, any cracks, anything like that. But everything's looking good. So now we can move on, and I'm going to just have you stick your tongue out at me. Straight out. Alright, and that's checking for cranial nerve 12. I'm looking for any deviation of the tongue from one side to the other, but it was nice and straight, so we'll move on with everybody's favorite, the gag reflex. So I'll have you open your mouth for me, or do you have a bad gag reflex at all?
I don't think so.
Okay, so I'll just have you open your mouth and say ah, and I'm just going to be touching the anterior pillar, and when you feel the urge to gag, just go for it. Very good. Alright, and the pillars raised equally on each side. The uvula was in the center. So now, the next portion of the exam, I'm going to use a cloth, and I'm going to have you stick your tongue out, and I'm going to just wrap your tongue in this, and so I can just get a better hold of it and move it from side to side, and that just helps me to see a little better, okay? So I'll have you stick your tongue out for me. Good. Just let me take your tongue. Looking at both sides, top and bottom, and everything looks good there. So the last part of this examination, I'm just going to check to see how easy it is for you to breathe through your nose. So I'm going to have you take your left hand and just plug your left nostril for me, and take a breath in and out. Same to the other side. Good. Any discomfort with doing that? Good. Alright, so the final portion is I'm going to just be pushing on your sinuses, your frontal and your maxillary, and then I'm going to be percussing it. Let me know if you have any discomfort, okay? Alright, so I'm just going to push here on the maxillary sinuses. Any discomfort? Frontal? Anything? Alright, now with percussion.
Nope.
Alright, any discomfort there would be indication of a sinusitis. And that will conclude our examination of the nose, mouth, and oropharynx.